Hi, Facebook. How are you this afternoon? Looks like a beautiful day out there. I want to visit with you a little bit again about COVID 19. But before I talk, I happen to have Dr. Fred Eccles here in my office today. We were just finishing up a meeting. And so I'd like for you to hear directly from him because he's the expert. He heads up our health department, for those of you who don't know, and he's really been leading our COVID 19 response and very ably and very aptly. So I'm going to turn this over to Dr. Eccles, have him visit with you for a minute. He can take a couple of questions, then he's got to scoot, and I'm going to be back. Hang on 1 minute. We'll have Dr. Eccles.
Good afternoon, St. Louis. I'm here to talk a little about some of the work that the City of St. Louis Department of Health is doing to continue our COVID-19 response. So over the weekend, I had the pleasure of working with some volunteers to go out and canvass areas in the northern part of the city, particularly those areas that have high poverty levels and don't have access to traditional media and internet. And so our goal there was to make sure that those individuals had access to COVID-19 information so they can know how to protect themselves as we move forward in our response.
Do you have time for some questions, Dr. Eccles?
Sure.
Can you first go ahead and update the community on total number of cases for the city right now to include how many people are being monitored and so forth, the typical numbers that we put out?
All right. So as of this morning, we have over 800 cases being reported in the city of St. Louis. We're monitoring roughly 133 individuals. These are individuals who have reported being exposed to someone who has tested positive for COVID-19. And we have one test that's pending with the state public health laboratory. However, there are other test results that are pending through some of our other partners, such as Affinia Healthcare, KSTL Health, and People's Health Center.
One of the questions that we got from one of our viewers is, what does it exactly mean when the health department says that someone's being monitored by the city of St. Louis? And does that automatically mean that they're in self-quarantine?
So when individuals are being monitored, that means that, yes, they are self-quarantined, meaning that because we only monitor individuals who have reported being exposed to someone who has tested positive for COVID-19. And so when we receive their report, if they're listed as a contact, we make sure that they are enrolled in our self-quarantine program, which is for 14 days from their last date of previous exposure to the confirmed case. And during that time, we collect information from them twice per day. So in the morning, we get a temperature as well as do a symptom check. We also do the same in the evening. That's done for the duration of their self-quarantine period. Individuals who remain asymptomatic throughout the duration of their self-quarantine period are deemed to be non-infectious, and then they're able to be cleared and returned to their normal duties, which includes work. However, in the event that someone develops symptoms during their self-quarantine period or self-monitoring period, we do link them to testing to have them tested for COVID-19. If they test positive, then they are removed from our self-quarantine list and they self-isolate, which means that we know that they're infected with COVID-19 and they have stricter measures that they have to follow throughout the duration of the isolation period.
Is more than 800 cases on par with where you thought or predicted perhaps the city would be at this stage in the pandemic, for better or worse?
800 having a little over 800 cases is actually good for the city of St. Louis, meaning, and again, I say it's good because that means that individuals in our community are adhering to those simple measures that we recommend every day. So people are staying home from work, people are implementing social distancing recommendations. If people were not doing those things, the numbers could be well over 1,000 or 1,500. So we're really grateful that the number is only 800. But again, there's a lot of work that we continue to do to make sure that individuals are adhering to those recommendations.
The city actually has one of our viewers complimenting the health department for working with the Missouri Foundation of Health and other FQHCs for opening new testing sites. Mm-hmm. We have 2 more opening in the city this week. Right. How important is the expansion of access to testing in our ability to relax social distancing restrictions?
Ensuring testing is available for all individuals across the city of St. Louis is really important. That's one of the key factors that we consider when we're determining when the city will be ready to reopen parts of the economy. And so that's been a challenge because testing resources have been in short supply due to the demand across the world. And so the City of St. Louis Department of Health, in collaboration with the Supply Commissioner's Office, as well as some private organizations, have been able to secure testing resources for our federally qualified health centers and other agencies across the City of St. Louis to ensure that we're able to offer testing to individuals that need it. However, we haven't received enough testing resources to open it up to the general public. And so over the upcoming weeks, we're looking to secure enough resources to open up testing to the entire city of St. Louis, regardless of, and allow individuals, regardless of their symptom profile, to be tested.
Okay, maybe final question for the doctor, one we often get, but we don't get a chance to ask you, Dr. Eccles. People who continue to see businesses in the community operate when they've not been deemed essential, how dangerous is that? What can people do? And what kind of information does the health department need to act on that?
So businesses that are not essential play a critical role, particularly in preventing social mixing. And so a lot of the businesses that we have deemed to be non-essential are those businesses that facilitate social mixing, which can facilitate the spread of COVID-19 in our community. So if citizens identify or come across an organization that is non-essential, according to our order number 7, there are different mechanisms that individual can report. So they can report, one, by calling the Citizen Service Bureau number, or they can also go to the city's website and report via electronic means. So they can submit the report through the internet to our Citizen Service Bureau to report those businesses that are not complying with our executive order.
Anything else you want to add, Dr. Eccles?
We really appreciate the work that the city is doing to really help us in this response. As I mentioned before, the City of St. Louis Department of Health, we cannot do this alone. This has to be a community-wide response, and we're grateful for those community members and those partners who are helping us adhere to the recommendations that we issue day in and day out. So thank you all.
Okay, we'll turn things over back to Mayor Krewson.
Good afternoon again. We've got something popped up here.
Oh, sorry.
That happens whenever people comment on the...
There we go. Thank you all. Appreciate you all being here. I hope you enjoyed or were informed by hearing from Dr. Eccles. He is really leading our response, and we're lucky to have him doing that. So just a couple of things. We do have 2 new testing sites, Affinia testing sites, that are opening today. One is at 4414 North Florissant, and the other is at 3930 South Broadway. Those are regular Affinia sites, but they have tests now, and you can call, and if you meet the screening requirements, you can get an appointment to have your test there. Their phone number, again, is 314-833-2777. Those 2 sites join the other sites that have been up for a couple of weeks now. One at 1717 Biddle, that's an Affinia site. One at CARE STL site, which is at 5471 Martin Luther King. I believe the CARE STL site on Whittier is still closed because they did have a couple of positive cases among their medical personnel. And then also 6763 Page in Pagedale, which is just right outside the city limits. So there are places to get tested in the city of St. Louis, easy access. These tests are free. I should be careful to say that again, that these tests are free, so you don't have to be concerned about that. So new testing sites, that's the big news for today. Do we have any questions?
Sure. Do you foresee a situation where the city will be able to offer, or the city and its healthcare partners be able to offer universal free access to testing for the public?
That is a great question. That's what we're headed towards. That's what we want to have, because we want to reopen our economy as soon as it's safe to do so. And one of the things that you have to reopen your economy is more testing. And, we would be doing a lot more testing now if we had either the testing kits or the swabs. And, but we don't have at this point in time. We have many thousands of test kits ordered, but they have not come in at this point in time. But I think we do have to have that, because once we do reopen our economy, which, what does that look like? Well, it means that some people will still go back to work in offices, but still encourage telecommuting for anyone who can telecommute. It means that at some point schools will reopen. That's later this summer, obviously. It means that maybe restaurants will be open, but with much wider table spacing, and probably in a different than we know restaurants to be right now. So before those things can happen successfully, we have to have a 14-day period of time at least with a downward trend on the number of cases. Now, if you've been watching this little podcast or this little broadcast all along, you know that we are projected to peak in number of cases in this region this week, towards the end of the week. And once that occurs, then we hope to see the number of cases going down the other side. And when we've had a sustained 14-day period of time, that's the first key to thinking about whether or not you can reopen some businesses. The second part is, do you have enough testing? Do you have adequate testing to test everyone who has COVID symptoms? The third thing is, can your hospitals provide care for the number of COVID patients in a normal way without, as you know, they've all stopped all elective surgeries at this point in time, but they'll have to begin those again at some point. And so all of those things have to fall in place, and testing is really the critical thing. Right now, we have been unable to obtain adequate number of tests. This is all across the country, all across the world for that matter, but particularly in our country. And so that is beginning to ramp up a bit, but we haven't seen those tests here in St. Louis.
So Dr. Eccles just said that as of today, the city has more than 800 cases, which might sound like a lot. He said that was kind of good place to be given the circumstances. Do you feel the same? And does that number keep us on the trajectory of peaking toward this weekend?
It's hard to say that 800 and I think it was 54 this morning cases is good, but it is definitely not as bad as we feared that it might be. So this is, a little about semantics. And the reason it's not as bad is because all of you have been staying home. You have been socially distancing. You've been washing your hands. You're wearing masks when you go out in public, I hope, around other folks. So yeah, it's not as bad as we thought it might be, but it's still a lot of cases. When you add together the number of cases, and these numbers were from yesterday, reported in the city, plus St. Louis County, plus St. Charles County, we have over 60% of the cases in the state. 63, I think, percent was what the calculation was yesterday. So while it's not as bad as it might be, we still are the hottest place in the state for number of cases.
You mentioned masks. Are face masks still, or are they required to be worn in public places and public spaces right now in the city of St. Louis?
They are strongly recommended. If you're going to go to the grocery store, the drugstore, anywhere where you're around other people, please wear a cloth face mask. This is mine that I have here. And save the surgical masks, and definitely save the N95 masks for healthcare workers who are dealing actively with COVID-19 patients. But yes, please wear a mask. You can make a cloth one. The internet, I know you're all on the internet because you're watching me on Facebook, but I'm seeing all kinds of patterns, I guess, or instructions pop up for how to make your own face mask. You can do it out of an old t-shirt. You can do it from a bandana. You can get a fancy one from somebody who's making it. And there are a lot of people out there using their talent and their fabric that they might have saved over the years in order to make masks. So yes, wear a mask, please.
Mary, you've probably seen across the country over the weekend, there were a lot of protests in various cities about wanting the government reopened immediately. There are protests happening in the St. Louis region today. What do you tell the people who believe that the stay-at-home order is excessive and that we should just reopen our economy, 5 minutes ago?
There's nobody who wants to reopen our economy more than I do. The effect on our businesses, the effect on revenue, the effect on our workers is devastating. So I understand that sentiment that of wanting to reopen the economy. But I don't want to reopen the economy at the expense of a lot more people becoming ill or a lot more people dying. And so that's why we have these steps in place that when we can achieve those steps, 14 days of downward trajectory, enough tests, when we can achieve, our hospital system has capacity, when we can achieve that, then we can slowly begin to open parts of our economy. I don't think for quite a while it's not going to go back to the way it was before March 16th when we had our first case here in the city of St. Louis. I imagine we're going to be wearing these masks for a while. We're going to be socially distancing for a while. But I absolutely want to get our economy back and reopen just as soon as it's safe to do so.
At what phase do you anticipate places that people have been wanting to have open, like beauty salons, nail salons, haircut places? Do you see those opening right away as we phase back open, or when?
So there's quite a bit of literature written on this, and your hair or nail salon probably are not the first place to reopen, as much as we would all like that, and that includes me. But because of the closeness of and the exchange of, you can't socially distance while you're getting your hair cut or getting your nails done. So I don't see them being the first thing to reopen.
Can the city consider closing some streets to make room for more people to spend time outside, like turning some streets into strict pedestrian or bike lane only?
I've seen where a few other cities have done that. We could certainly consider that, but we have 109 parks. We are very fortunate to have that number of parks, and we have closed most of the roads in parks, in our big parks. And so we have felt like we have enough capacity for people to walk as it is, but I'm not opposed to that idea. If it's a place that we think needs more access to walking space, I'm certainly not opposed to that. But we've been relying on keeping our parks open right now to give people that opportunity.
One of your viewers is asking about building inspectors to know if they are considered essential and are still working, because this person has an abandoned building next to their house and that they would like an inspector to be able to come out and take a look at it.
Yes, building inspectors are still working. They are not going inside occupied buildings, so they're not doing what we call a conservation inspection or an occupancy inspection on the inside of a building that's occupied, because it's just not safe. But if you have an abandoned building that you think has some exterior building violations, then yes, your building inspector can come look at that building and cite that building for the violations. To put in a request for that, call 622-4800. That's the Citizen Service Bureau line. Be sure to give the address of the abandoned building, not your address. Give the address that you want inspected. If you're able, go out in the street and take some pictures of the building and the violations that you see on that building. And instead of calling it in, go online, because you're all online. Go online through the city's website and upload those photographs, because, a picture's worth 1,000 words, they used to say, and maybe more. So I think it's always good to show some of those pictures. If it's right next door to you, you may have a view onto that property that the building inspector may not get, because the building inspector is going to stay on public property. So you get the drift. Upload some pictures, provide the address. The building inspector will come and inspect that building.
James is watching and wants to know who in the city is responsible for enforcing large gatherings that might have more than 10 people, and is that the same number that Dr. Eccles gave about reporting businesses that he can use if you
Yes.
see a violation of 10 or more?
Yes, it is the same number. 622-4800 is the Citizen Service Bureau line, or at STLCSB is the Twitter. You can tweet CSB or go online and provide some pictures if you can. So that's the best place to do that. Still a 10-person gathering limit, and social distancing at the same time, and masks.
How have people been complying? Do you think have most of people been listening to the orders? Do you think?
I think a vast majority of the people in St. Louis have been listening to the orders. And I say that because, of course, I'm hearing from people on who are really stressed out because they have been staying home and they don't have their normal social outlets. Then, of course, I'm also hearing from people who have to go to work, like your building inspector that you just asked me about. But I think the majority of people are really taking this seriously. And I think results we can see in the number of positive cases we've had that folks are taking it seriously.
You're getting a couple of compliments for keeping the city parks open.
Good.
Do you anticipate that decision remaining the same?
I do.
Let me look through these questions real quick, Mayor. This might have been a question for Dr. Eccles, but you've talked about it some. One of your viewers is asking about the importance of coming into contact with the people who have been, the contact tracing process is what I'm trying to say. How important is it to know the extent at which a positive person has been out and about?
So if someone has tested positive for COVID-19, then the health department immediately is in contact either with that individual or perhaps the people they work with or that they're connected to figure out who in their circle would have been exposed to them for more than 10 or 15 minutes, I think, would have had what's called a prolonged exposure. And then they get in contact with that person or persons, usually persons, and have them self-quarantine for 14 days to see whether or not they end up 14 days from the last exposure to the individual who tested positive. So, I mean, that's very important. That is how you stop the community spread of COVID-19.
One of your viewers is curious how many shelter beds are currently available for unhoused individuals, and is there a number that someone can call if you know someone who could use shelter right now?
Yes, thank you for that question. So on a normal spring, summer day, the city has 532 shelter beds available. Now, the shelters that we normally fund and who provide those beds have been reducing the number of occupied beds in order to be able to social distance the folks who are there more. So that 532 is probably down by a couple of hundred. And the city has brought over 200 new beds online. The last place is coming online today. That's 33 beds. And so over the last 2 weeks, week and a half, we have brought 200 new beds online. So there is a bed for everyone who is on the street if we can persuade them to go into shelter. We have been doing outreach literally every single day to folks who are on the street. And we have been successful in some cases, maybe a dozen cases, maybe a little bit more than that now, over the last few days of getting people to go into a motel room, a congregate care facility. And we just have to continue to work on that because we've got to approach people every day to try to persuade them that it's not safe really for them to be on the street, particularly in a situation where they are not socially distancing, and to go into shelter.
Nicholas is watching, Mayor. And
hi, Nicholas.
He says the collector's office is still sending out the tax bill and wants to know if the city is considering an extension on the deadline for paying your taxes?
So the earnings tax, I think, is what you're referring to. The earnings tax has been extended. You don't have to pay that now until July the 15th. So and that's because the IRS, as you know, extended the deadline for filing your federal tax return, and the state did the same. So you have till July 15th to pay your earnings tax. Now, if you're talking about maybe personal property tax on a car or real estate tax on your house or your condo, then those were actually due on December 31st of this past year. And so those have been overdue for a little bit. So you might want to try to figure that out. You can make partial payments, etc.
So a couple of financial questions related to the impact on the city's finances. Kyle is watching, not the Kyle from our office,
Okay.
a different Kyle. Kyle wants to know the city's plans to mitigate any decreased revenue as it relates to COVID-19, and are we considering any layoffs or furloughs?
So we have a reduction in revenue of tens of millions of dollars, probably around $30 million in this last quarter, just April, May, June. And we're looking at somewhere between, and we don't know for sure, $40 and $60 million next year. On Wednesday, this week, 2 days from now, the Board of Estimate and Apportionment will be reviewing and considering the budget that our budget director, Paul Payne, has put together. And there are a lot of unknowns at this point in time, but there are a lot of things on the table that we have to do to balance the budget, because we're not like the federal government. We can't run a deficit. So by law, we cannot run a deficit. So we have to figure out a way of balancing that budget.
This might be more clarification question. Jonathan's watching and wants to know the gradual reopening process. Is that triggered by the availability of testing or the total caseload of positive cases that we have, or both perhaps?
It's both, and as well as hospital capacity. So it is seeing a downward trajectory on the number of positive cases that we're getting. That's number one. Number two, having enough tests available to test everybody who needs a test, everybody with a symptom. And then three, having enough hospital capacity to take care of COVID patients sort of in the normal course of business. So it's all three of those things, and before business and the economy reopen in a major way.
A couple of questions about our libraries, which closed shortly after all of this began being placed. Do you anticipate, or where in the process do you anticipate them being open? They're an important lifeline for people with internet access and such.
So at this point in time, I would not expect libraries to reopen before we lift the stay-at-home order, for sure. We don't know when that'll be. We're going to reevaluate that week to week and be back to you by May the 15th. So I think some gradual reopening might be able to be done with libraries at some point in time. But again, it's going to look different. It may be, maybe there would be temperatures taken. Maybe there would be social distancing. And sometimes in a library, that's not too hard to do because they're bigger spaces. But all of that, when does that reopen? When does the art museum reopen? When does your favorite restaurant reopen? When does your workplace reopen? And again, those are all things that are being worked out now.
Dawn is watching, Mayor, and Dawn is curious about the order from Judge Burleson in the 22nd Judicial Circuit that expired yesterday. Are they extending all of that? They
are. In fact, that may have already been done today, but we have asked them to extend that order to stay evictions during this time period.
John is watching and is curious how people at the state level, like Governor Parson, have helped the city throughout this process.
Well, Missouri is a big state. Not every county is the same. So one of the things, as you probably know, in the CARES Act, CARES 1 we call it, hoping that there'll be CARES 2, but in the CARES Act, the state of Missouri got or will receive, they may not have gotten it all yet, I think it's $2.4 billion. Of that $1 billion, about $1 billion of it is allocated for other counties and cities. And so we are working with the state right now to get what we hope will be a pretty substantial sum of money, because we are spending a lot of money. We're spending it on testing and gloves and face masks and homeless services, et cetera. We're spending it like we have it. And so a lot of that we need to get reimbursed for. And so hopefully the state will pass through some of those funds to the local level. Now, I don't believe the state has received them yet. I don't think they actually get the money till maybe the end of this week. But we hope to get the funds shortly thereafter, at least get a part of those funds shortly thereafter. So that's going to be very important. As you might know, there were 2 counties in the state of Missouri which got direct allocations from the federal government. St. Louis County got 170 some million directly from the federal government, and Jackson County got about 100 million directly from the federal government. And that's because those counties had more than 500,000 people. So every place else in the state is dependent, every other city or county in the state is dependent on state government to allocate those resources back to us. And so that's extremely important for us.
Mayor Alderman Pam Boyd from the 27th Ward is watching.
Hi, Pam. Hi, Alderwoman.
And she's wondering if you know about a testing site at 5541 Riverview.
Yeah, 5541 Riverview. I do know about that. Well, why isn't it on my... That is if I'm not mistaken, that's a CARE STL site, Alderwoman, and they are doing testing there.
We'll have to get that added to our...
Yeah, I'm looking to see. I know that is a federally qualified health center there.
We'll get that added to our list, Alderwoman. I think that's it for questions today, Mayor. If you want to wrap up
Good.
or have any other
Good.
thoughts.
Thank you all. I just wrap up in the same way I always wrap up, which is to thank all of the residents of the city of St. Louis who are staying at home. That's tough. You've got your kids at home in many cases. You're trying to do education for them. You might be trying to work from home at the same time. And so thank you, though, for that effort. And then thank you again to all of the folks. And there are many people out there who are essential workers who continue to work. Our healthcare workers, doctors, nurses, people who work in dietary, people who work in housekeeping, people who work in x-ray, all of those folks. Thank you to our healthcare workers. Thank you to our grocery store workers. We know that you're working extra hard. Thank you, of course, to our city employees, our police officers, our firefighters, dispatchers, folks picking up your trash, the folks who are in the water department, the folks who are working at the airport. I know I'm leaving a few people out, and I apologize for that. But many people, our building inspectors, many people are working, and they are working because what they do is essential. So thanks to all of you who are staying home, and thanks to all of you who are working. We really appreciate you. Thank you.